Hi, this is Larry Green with the Touch for Health Kinesiology Association, and I want to talk to you about what we call the self-responsibility model. Touch for Health Kinesiology is a system of taking care of yourself and your family that was developed by Dr. John Thie, who was a chiropractor. And he was seeing clients, and he was using something called applied kinesiology with great results. And he had many of his clients who said, "Can I do this at home?" This was back in the early 1970s, and at that time, only doctors, chiropractors, and MDs could be trained in how to do applied kinesiology. And he said, "I think I want to be able to teach my clients how to take care of themselves, because that's what they want. They want good health, and they want to be involved in it." So he put together a manual called Touch for Health that was about how you could take care of yourself and your family using simple reflexes and a form of acupuncture that didn't use needles. And a basic foundation of it was that it was about education and self-responsibility. And the idea was that we can be responsible for our own health. So instead of running to the doctor for everything, we could actually do things for ourselves, for our family, for our friends, to help us stay healthy, to maintain our health, and to get our body back into a healthy state when we have those moments when we drop off, when you get a bug, or when you're just not feeling so good, or things like that. So the self-responsibility model is really central to what we teach. So if you're somebody who wants to have more control of your life, if you'd like to save money on medical expenses, if you'd like to be able to have a freer existence, let go of stress more easily, Touch for Health can be really helpful for that. And I'll tell you a quick story. One of my mentors is a medical doctor named Dr. Bruce Dew. He had a very bad autoimmune disease back in the 1970s and was told by numerous doctors he would die in 6 months and nothing could be done to save his life. By some coincidence, he discovered Touch for Health. And now in 2017, he's still alive, and it saved his life. And he said at that point, he had to learn how to do this stuff. And he was a straight medical doctor. And he converted his medical practice into both a kinesiology and standard medicine practice. So he would still give people drugs if that was the thing they need. But he said at one point, everybody who came to see him, he gave them what we call a 14 muscle balance. It's a process where you test each of the meridians from acupuncture, and then you find the ones that are under-energized, and working with reflexes on the body, on the head, in the field, you rebalance the system. So it's like acupuncture, but without needles. And he said for a period of time he did a study, and everybody who came to see him, no matter what they had, he gave them a balance. And he said 50% of his clients, just getting the balance, relieved whatever it is they came for. They didn't need drugs, they didn't need surgery, they didn't need anything else. Just balancing their system allows the body to respond easier to life and overcome stress and challenges. It's something you can learn for yourself, and you can take more responsibility for your life, save money, save stress, and have a much more interesting, happy life, and know how you can do cool things for yourself so you feel good, your family can feel good. My grandkids know how to do this stuff. It's not complicated, and I invite you to check it out. And so it's about taking responsibility for yourself. Now, if you're one of those people who no matter what happens, you want to run to the doctor, you want the doctor to fix it, you don't want to have anything to do other than having the doctor do it, don't take Touch for Health, because we're going to teach you how to take care of yourself. But if you do want to take care of yourself, Touch for Health is it.